Hi everybody, welcome to RHI's Day of Giving. A really special day for us, an exciting day for us here at RHI. We're going to talk a little bit about what that all means in terms of where things land and donations and things of that sort. But before we start, I want to recognize some of our sponsors, which we are extremely grateful for. One of our sponsors, will highlight our title sponsors. One is Unified Group Services, Superior Van and Mobility, Bose, McKinney and Evans, and Bose Public Affairs Group. So we want to say to them, huge thank you for being our title sponsors. We're very grateful to all of you. Mindi?
Thank you, Dan. Dan is the CEO of the Rehabilitation Hospital of Indiana, and he's one of my favorite people. I just adore working with him. He's such a great leader. And he is our greatest champion here at the RHI Foundation. So we're pretty excited about our fundraising initiatives, which he is in full support of. And everything is focused on our patients. It's all about providing the best experience, the best patient care, and the best outcomes for our patients. So every hour, at the top of the hour, this day of giving, we're going to be featuring past patients or experts talking about the magic that happens here at RHI, why we are here, why we're asking you to join us as donors and support the amazing work that we do. And you're going to hear a little bit later about research, which is one of our huge funding priorities this year. Research is a really big one, so please tune back in for that. We've got our research director, Dawn Newman, who's going to be talking a little bit about that. And we've also got some that we're not doing private episodes on at the top of the hour. One is about a new unit. We're getting ready to build a new unit. Dan, you want to share why that's
Sure.
such an important initiative for us?
Sure, and thank you for the introduction. It goes back to you, Mindi. Certainly reflective of your care and concern for all of our patients in our system. Mindi is a great representative and is symbolic of all of our leadership, our staff, our teams, our doctors, everybody that comes in contact with our patients. So thank you. We're blessed to work together too. So yeah, Mindi mentioned we have a new unit coming about, and really that is also symbolic of a variety of things. We here at RHI see many different types of patients and very special patients. Each and every one of them are special across a variety of different programs. Some of those programs include patients that suffer or sustain transplants, liver transplants, pancreases, a variety of different things in that area, comprehensive medical issues, traumatic brain injury, spinal cord injury, trauma, neurologic conditions, stroke, and things of that sort. So as a part of continuing to ensure that we meet our patients' needs, and in particular the brain injury population, we are building a new unit, and that new unit is going to be made up of a very special presence and ambiance for our patients, where the environment is such that it's meeting all of their needs and the team's needs, the staff needs, and treating those patients so they can maximize their recovery. After a brain injury, it's necessary for individuals to have quiet areas, sometimes areas they're treated individually in private rooms or private treatment areas, and just have an environment that is soothing so that the brain can recover. In some cases, people coming out of comas all the way through moving forward to getting back to work. So we have this new unit that will offer up private rooms to all of our brain injury population. And in an effort to look at ensuring we're meeting all those needs, we brought together pretty significant teams, cross-sectional teams. So as I work with Mindi here and everybody that's involved, not only in the foundation, but with the rest of our family, as I call it, we did also get together to generate plans and architectural plans, clinical plans, and things of that sort, so as to meet not only the patients but the families' needs. Because we know that families, significant others, friends are necessary to support patients' improvement and quality of life as they continue to recover from their injuries. So we are extremely excited and feel very blessed to add this unit onto our existing 4 units that we have focus on, as I mentioned before, in terms of programs. And we're hopeful that we continue to support as we need every single patient across our entire community, and we don't want individuals obviously to sustain brain injuries, but in the effect that they do sustain these devastating type of traumas, we want to be there for them, as we have been many, many years of past, with now a new facility unit. So we're really thankful for the support that we've gotten from all of our donors and things of that sort, and we're hopeful that during the course of this day of giving that we are equally able to supply and support a variety of different types of needs of those patients that suffer brain injuries.
Yes, thank you. That's such a great summary of why we're doing the new unit. And we have other initiatives that we're funding this year. Another one that's really important is our clinician training and education. So this is imperative for us to remain the best of the best. Our nurses, our therapists, all of our clinicians need to maintain their licensure, and they need to find out what the latest and greatest is in their own skill and what they're doing. So to practice at the highest level of their skill, we have to constantly invest in training and education, which can be a challenge for a nonprofit hospital. RHI is a nonprofit hospital, and so it's through philanthropy that we are able to fund the continuing training and education for our clinicians. And that, again, it helps improve and provide the best possible patient experience, patient care, patient outcomes. It's always about the patients for us. And another thing that we do as nonprofit, we have $1 million or more of charity care that we provide every year, which is significant. And that it really limits our margin, our operational margin, how much profit we have that we are able to reinvest back in the system. And as you well know, we have a lot of expenses as a hospital. We have IT needs that we have. We've got just maintaining our huge facility that we have. So doing things like building a new unit, investing in research, providing training and education, all of that stuff can't really be done on our small operational budget because we're a nonprofit. And we do over $1 million of charity care every year. So it's through philanthropy that we're able to do these things. It's through your gift that we're able to make what we do even better and even greater and remain the best of the best in rehab. One of the other things that we do is the Patient Assistance Fund. So we provide shoes for some of these charity patients that we have, the patients that come and they can't afford shoes, but they need that in order to safely participate in their therapy. So it's your gift that does that. If you make a $50 gift, you've just bought a pair of shoes for a patient who desperately needs that and can't afford it. Insurance doesn't pay for it, Medicare doesn't pay for it, Medicaid doesn't pay for it. It's you that pays for that. We also provide medications for patients when they're discharged. They may not have the setup through insurance or personal means to get the medication that they desperately need when they leave RHI. And it's through philanthropy that we can do that, as well as our durable medical equipment. Maybe they need a transfer board or a walker or whatever it is that they need to live their life as independently as possible once they leave our facility. That's all through the Patient Assistance Fund. So every dollar you give goes directly into improving our patient care, our patient experience, our patient outcomes. It's all about the patients. So please join me, join our CEO, Dan Woloszyn, as donors, join our foundation board members, and make a gift. Click on the link, make a gift right now. And also, if you could share this video and all the videos through your own social media outlets, that will help us improve the community awareness of who we are, what we do, and celebrate all the things that happen here. This is a really magical place, and you can be a part of it.
Mindi, thank you so much for also letting everybody know about where the dollars go. I do want to say one other thing, and it's really related to something that's pretty easy for me. That can be difficult in other situations. I'm in the easy place to tell our donors, and I have told them this, exactly what Mindi stated. All dollars, 100% dollars go back to our patients, back to the families, back to the caregivers and people of that sort. And that's it's a really nice thing to be able to say that and not to have to go through the fact that we're working for earnings per share or working for stockbrokers, whatever that might be. And it's a really, I'm grateful to be able to say that. And our donors also connect very, very well with that. So I'll say that to all of you as well, kind of reinforcing what Mindi stated. Please, please, please take the time to think about this. Take the time to donate. Whatever is within your means. We appreciate everything. Our patients appreciate it. Their families appreciate it, and certainly our teams do as well. So with that, thank you for viewing us, and take care to all of you. Thank you.